Vasodepressor, vasovagal syncope in dentistry, signs, differentials, and management. Vasovagal syncope is the most common cause of loss of consciousness in dental settings. It is typically stress-induced and associated with fear, anxiety, and pain. This condition must be recognized rapidly to prevent airway compromise, hypoxia, and complications. Syncope may resemble other emergency conditions such as hypoglycemia, myxedema coma, severe hypothyroidism, or arrhythmias. Diabetic patients may experience syncope with normal glucose levels. Some patients may be unaware they have diabetes or thyroid disease. Syncope may present with either bradycardia or tachycardia. In dental scenarios, syncope is commonly linked with psychological stress or dental phobia. History often reveals anxiety before the episode. Syncope evolves in 3 phases. 1. Presyncope. 3. Postsyncope. Early presyncope symptoms develop rapidly. Patients may feel warmth in the head, neck, or face. Pallor, nausea, sweating, and normal blood pressure are common. Tachycardia above 120 beats per minute may occur. In the late presyncope phase, patients may experience pupillary dilation, yawning, hypopnea, cold extremities, hypotension, bradycardia, visual disturbances, dizziness, and possible sudden loss of consciousness within seconds. Syncope is the full loss of consciousness. Breathing may become irregular, shallow, or completely absent. Pupils become dilated. Involuntary twitching may affect facial muscles, hands, or legs. A weak pulse, muscle relaxation, and airway obstruction risk increases. Urinary or fecal incontinence may occur. Bradycardia of 50 beats per minute or lower, and arterial hypotension of approximately 30/15 millimeters of mercury may be seen. Periods of asystole may occur. Recovery is rapid when managed correctly. Consciousness returns, accompanied by pallor, weakness, nausea, sweating, and disorientation. Blood pressure and pulse gradually normalize over minutes to hours. Step 1. Place the patient in a supine position and elevate the legs. Step 2. Provide oxygen. Step 3. Maintain the airway and reassure the patient. For unconscious patients, maintain airway with head tilt and chin lift. Provide oxygen, monitor vitals, and continue supportive measures until recovery. Syncope in dentistry is stress-related. A history of anxiety or phobia is a frequent clue. Recognizing presyncope allows prevention of full collapse. Vasovagal syncope is common, predictable, and manageable. Rapid identification and immediate treatment lead to fast recovery and reduced risk. This concludes the presentation on vasodepressor syncope in dentistry. Management of hypoglycemia, insulin shock, signs and symptoms. Blood glucose, Bg less than 3.0 mol/L, normal range 5 to 7 mol/L, equivalent 90126 mg/dL. Early symptoms in a conscious patient: hunger and nausea, sweating and shaking, irritability and anxiety, rapid, weak pulse tachycardia, headache and weakness. slurred speech, uncooperative behavior, paresthesias and goosebumps, mood and behavior changes, neurological and severe symptoms, diminished cerebral function, increased gastric motility, tonic-clonic seizures, hypotension, hypothermia, cold skin, loss of consciousness. Management. If patient is conscious, 1. Position upright or safety upright. 2. Provide fast-acting sugar or a high-sugar drink. 3. Monitor symptoms and vital signs. If patient is unconscious or seizing, 1. Position supine. 2. Call emergency services 911. 3. Ensure airway head tilt chin lift unless contraindicated. 4. Administer oxygen. 5. Give 50% dextrose, 4 or glucagon 1 mg SCIM or 4.6. Monitor vital signs continuously. If dextrose or glucagon are not available, administer 0.5 mg of 1 to 1000 epinephrine SC or IM. May repeat every 15 minutes. Proper recognition and rapid management can prevent severe outcomes. Have you ever heard of a myxedema coma? It might sound like something from a sci-fi movie, but it's a very real and life-threatening medical emergency. Imagine this: a quiet ICU room, monitors beeping softly. This is where a patient with myxedema coma might end up. But what exactly is it? It's the most severe form of hypothyroidism, where the thyroid gland is so underactive that the body's functions slow down to a dangerously low level. It's a rare but critical condition that requires immediate medical attention. Knowing the signs and how to react can truly save a life. Let's break down what you need to look for and what happens during emergency management. First, let's talk about the signs and symptoms. They can be subtle at first, but quickly become severe. One of the most telling signs is profound hypothermia. This isn't just feeling a bit chilly. The person's core body temperature drops dangerously low, often below 95 degrees Fahrenheit. You'll see them wrapped in blankets, yet still feeling incredibly cold. Alongside this, respiratory failure is a major concern. Their breathing becomes very slow and shallow, which means they aren't getting enough oxygen. This can lead to a buildup of carbon dioxide in the blood, a condition called hypercapnia. You'd see this on a blood gas monitor. As the body's systems slow down, circulation is also severely affected. This leads to hypotension, which is dangerously low blood pressure. The heart rate can also drop significantly. These circulatory problems reduce blood flow to vital organs, making the situation even more critical. Then there are the neurological signs. The person might seem extremely confused, lethargic, or minimally responsive. They might not be able to answer questions, or could even slip into a coma, which is where the condition gets its name. An extreme sensitivity to cold is another classic symptom, even before the full-blown hypothermia sets in. So, what do you do if you suspect someone is in a myxedema coma? This is an absolute emergency. The first and most crucial step is to call for emergency medical services immediately. While waiting for help to arrive, It's important to monitor their vital signs if you're able to check their breathing and responsiveness. Once in a medical setting, supportive care is key. The team will focus on gently warming the patient using blankets and other warming devices. They have to do this slowly to avoid causing other complications like a drop in blood pressure. Medical treatment involves a combination of medications and fluids given intravenously. This includes hydrocortisone, a steroid to support the adrenal glands, which are often also affected. The most critical medication is a form of thyroid hormone, usually thyroxine, given directly into the vein to start correcting the underlying hypothyroidism as quickly as possible. IV fluids like saline and glucose are also administered to correct low blood pressure and low blood sugar. If the person's breathing is too shallow, they will need airway support. This could mean an oxygen mask or even a ventilator to help them breathe. If their heart stops, life support measures like CPR will be started. Myxedema coma is a stark reminder of how important our thyroid gland is. While it's a terrifying condition, the good news is that with early recognition and rapid medical intervention, patients can recover. The key is to never ignore the signs of severe hypothyroidism. Being aware and acting fast can make all the difference. Thank you for watching. If you found this information helpful, please like, share, and subscribe for more medical insights. Stay safe and informed.